welcome. You're with Indiapostlive.com, India's first live conversation web television. This is a platform where we talk about issues that are trending on social media. We also take up a lot of offbeat stories, an issue which traditional media is not talking about. But today's topic is definitely something that is trending both on social media as well as on traditional media. More than 13,000 people in India have contracted the H1N1 virus. In fact, the Ministry of Health on Sunday released the figures of the death toll, and that stands at 812. So more than 800 people have died, more than 13,000 people have contracted the H1N1 virus, which is the swine flu. Now, basically, from this year itself, there have been over 400 deaths. And during the same period, more than 6,000 people have tested positive, and like I said, 13,000 people and 812 deaths. Now that is definitely an alarming situation. The government seems to be grappling with this problem, and there are a lot of issues where the people have accused the private hospitals of charging exorbitantly for the test itself. Now the government of Delhi, Arvind Kejriwal's government, has put a cap on the price of the test at 4,500 rupees. We'll talk about all of that. Now I'm joined by an expert panel. I have Dr. Anurag Saxena. Dr. Anurag Saxena is a physician with the Primus Hospital of New Delhi. He joins us online to give us more information and details about swine flu. Dr. Anurag Saxena, welcome to India Post Live.
Thank you very much.
Okay. I can't hear Dr. Saxena. Let's try and fix the audio. Okay, we also have Dr. L. Sreenivasamurthy. Dr. L. Sreenivasamurthy joins us from Bangalore, and he is the medical director of Nightingale's Home Healthcare. Dr. Sreenivasamurthy, welcome to India Post Live. Thank you so much for joining us all the way from Bangalore.
Thank you, ma'am. It's my pleasure.
All right, great. We are also hoped to be joined by Dr. Geeta Rani Arora. She is the R&D head, or the research and development head of BJN Pharmaceuticals, and she'll give us an alternate view, you know, the homeopathic solutions, if any, to the swine flu problem. Okay, let me, before we start off the conversation with our guests, let's get you 5 very important, very crucial things that you must know about swine flu. Of course, the most important thing is it does not happen by eating pork. There are very, very important things that you need to know that's coming. Let me just talk to you about that. Okay, before that, we'll just give you the figures once more. This year itself, almost 500 lives, totally, of course, 812. That's what the ministry is saying. A lot of people have accused the government of downplaying the number of swine flu cases and discouraging laboratory testing for the virus. That is also another issue we will have to talk about. But even these figures released by the government are definitely alarming. More than 13,000 people who've been infected. Okay, 5 things you must know about the deadly virus, the H1N1 virus. This is a disease caused by the influenza virus that infects the respiratory tract of pigs. That's where it gets its name, swine flu. Swine flu spreads from person to person through air, mucus and saliva. Remember, it is highly contagious. Now, despite its nomenclature, eating pork or pork products does not spread H1N1. Please remember this. It is spread through other ways. It's very contagious though. What are the symptoms? It includes cough, fever, headache, sore throat, muscle pain, chills, vomiting and diarrhea. So there is a huge tendency to confuse it with seasonal flu, normal viral fever as we call it. The flu, people will confuse it to that. Children below the age of 3, pregnant women, adults above 60 years or those with weakened immune systems are more vulnerable to the virus. Now the Delhi government, as we said, fixed the rate for tests at 4,500 rupees, and this is to prevent overcharging by private laboratories. Tamiflu is the recommended drug against the virus. Okay, these are 5 important facts that you need to know about swine flu. Remember, it's highly contagious and the symptoms are very similar to ordinary flu. Now, the common flu as it is called. All right, let me first talk to Dr. Sreenivasamurthy. He joins us from Bangalore. Sir, any other additional information you can give us besides what we've just told the people?
I think first thing you should encourage people to keep themselves personal hygiene at a very high level in these outbreaks.
Right.
So the point is, as you rightly said, it presents like a common flu. So make sure all the flus are treated as swine flu at home. For example, the patient has to be isolated at home. That means he has to restrict exposing himself and his saliva and other contacts, for example, while sneezing and coughing. To stay away from, abstain from the other family members, especially children below 5 years and elderly above 55, 60 years, and who are diabetics, who have asthmatics, who have renal failures, kidney failures. These are the people who are more susceptible to catch up these infections. And they are the ones who are supposed to be staying away from these infected individuals.
All right.
And very important point is the personal hygiene of the infected person. That's where the problem starts off, because he keeps spreading before he realizes he's got a swine flu. So anybody with the common flu symptoms, which are like your cough, fever, sore throat, running nose, please go to the doctor, take the standard treatment what we prescribe for all the flus. And even we as doctors will not diagnose it at day 1. When the patient comes back, say after about 48 hours with a standard therapy, does not respond to the usual regimen of the treatment, then we have a suspicion, and then we go ahead and try to treat them.
Right.
So please go to the doctors at the earliest and don't be afraid. The scareness has become more rampant than, people have started taking Tamiflu on their own without any symptoms, because they said somebody in the neighborhood had a problem with their neighborhood, somebody had died, something like that. These kind of news are rampant, and they have ended up taking Tamiflu unnecessarily. Please do not do that. Do not panic.
Do not panic. Of course, definitely, like you said, the fear psychosis is very important, Somebody has it. But doctor, what's the first thing? I mean, when do I know? Suppose I have these common symptoms, fever and cough and body ache and all of that. Now, definitely, I know that I mean, whenever I have had a viral fever, as we call it, the common flu, it's not really been accompanied by vomiting and diarrhea. But when do I know that I have to get worried and I might need to get myself tested?
Okay, the first thing, as I said, as soon as you get your common flu symptoms, just go to the nearest doctor and take treatment. And with the treatment, the first 48 hours are kind of crucial, wherein you don't respond to the standard therapy. You become more sick, you have sore throat increased, you have cough increased, you have tiredness, you develop vomiting or any diarrhea. Any of these symptoms, please get back to the doctor so that the doctor asks for the swab test. And the other risk factor is the history of travel in these days. For example, today I had a person who had visited Jaipur and he's tested positive. I mean, 3 days back. Today the swab test came positive. But I am treating him as an outpatient basis, not even getting admitted, because he's all right otherwise. And he does not have risk factors like diabetes or, and he's a youngster, he's about 40 plus. So I'm treating him as outpatient, and I've told the family members, I counseled them, there are about 4 people, including his parents in the family. So I told them the personal hygiene, isolation, restrict himself to the house and do not go to his office, these kind of things. And this is where the awareness of the people plays most important role, which is very, very important. And that's what I feel is lacking in our patients.
Right.
Because we have been treating, like I've treated at least six patients, sick patients in the ICU, and I have not got any contact, because you need to maintain that personal hygiene and make sure that you don't spread to the others.
Absolutely, absolutely. Okay, so, he repeated that, Dr. Sreenivasamurthy, and for all of you, even after 48 hours of developing symptoms like the common flu, if it gets worse and if it is accompanied by diarrhea and vomiting, go back to the doctor and definitely get yourself tested. Okay, that is the first thing. Do not panic, do not fear. Having swine flu does not mean you have to get yourself admitted, does not mean you will die. Please don't worry. Please don't, get panicky. Just be calm, be cool. Follow the right hygiene. You have to wash your hands try and avoid shaking hands with people, all the time, or, unnecessarily. If you can avoid it with a namaskar, keep it like that, at least till this outbreak comes to a, is controlled. Okay, let me get back to Dr. Anurag Saxena now. He joins us. He's a physician at Primus Hospital, New Delhi. Dr. Saxena, Delhi is a city where there has been a huge number of cases. We will come to the statistics, statewide statistics as well. This fear psychosis that we were talking about, what as medical experts can you do to ensure that the fear psychosis does not spread and people are more or less educated about what to do and what not to do?
See, it is basically the education that we doctors have to impart to the public at large.
Right.
It is the availability of the information is very much lacking nowadays, and that is why there is so much of a fear psychosis all over the India, more so in Delhi, I suppose. On the first day of getting fever or body ache, they are rushing to the hospitals that I have got swine flu. And the swine flu can be treated easily, but it is very difficult to treat the fear psychosis in those patients.
Absolutely.
So the first thing is that we and the media, including everybody, has to do is to dispel this fear that swine flu is going to kill you, or it is a very serious illness, and once you get swine flu, you are not going to make it. So this is the thing which is at the top of the mind in every patient who is getting fever, who is getting cold, because as Dr. Saab has already said, and you have already said, that all the fevers, all the colds, all the running noses are not swine flu, and this should be put into the head of each and every individual of the country, that don't be afraid of it. It is not swine flu. Secondly, it is not your headache to prove that it is swine flu or not. It is the headache of the doctor whom you are visiting. It is his responsibility to see whether it is swine flu or not.
Right.
So kindly not jump into the conclusions that I have got swine flu or I should be tested for swine flu.
Absolutely.
There are definite guidelines for which a person should be tested for swine flu
it's
or
a blood
not
test,
tested
right?
for swine flu.
It's a normal blood test?
No, it's not the blood test. It's the swab from the nasal and throat mucosa.
Okay.
So it is person for the general public, not for the patient to decide whether he's got swine flu or not. This thing should be, it should go to each and every person, that it is for the doctor to decide, not for the patient to decide whether he needs a test or not, because there are definite guidelines, right?
Right.
So we have to divide into three categories, category A, B and C, and if you fall in category C, only then you require a test for the swine flu. Otherwise, if you are in category A or B, you are not required.
Right.
Now, we can go into the details of categories later on, because this is more of a medical thing. How do we decide the category?
But there's one problem in Delhi, at least. This is a time when the weather is changing. Winter is coming to an end. Hardly any spring. It's already become quite hot, and the weather change is the time when many people do contract the ordinary influenza, the ordinary flu. So definitely, I'm sure you have a lot of cases coming to you which are but ordinary influenza, but this fear psychosis makes them feel, like you said, that, oh, I have swine flu. So do you think as a doctor, the government or other organizations are doing enough to educate the people about this?
No, I don't think so.
Right.
Because had they been this, if they would have been doing like this, then the fear psychosis would not have been so much. So, and I should blame, if I may say so, I would blame media for this more than anybody else. See, government has got very limited resources to talk to the general public, but media is very friendly with the people. And so I think media is the first thing, is the first person in the media. They should be telling all the general public through their different web posts or from their channels or from their print media that this swine flu not to be afraid of as they are getting afraid right now. Secondly, it is treatable. Even if you get it, you should not be fearing a lot about it because it is treatable. And thirdly, it is a preventable disease and it could be prevented easily.
Right. Let's talk about. Okay, let's talk about prevention. Dr. Geeta Rani Arora has joined us, but I'll get back to her in a bit. Let me talk to Dr. Sreenivasamurthy now. So, is there any sort of vaccination that is available right now? If you could tell us a little bit about prevention of this disease, besides hygiene and all that, is there any other method by which we can prevent swine flu?
Okay, there is a definite vaccination available. But the point is, vaccination gives your immunity. After you prick, for example, you take a prick today of the vaccination, it takes 3 weeks to produce the immunity against the disease. So people who are at high risk are the people who are recommended to get vaccinated, like doctors and the ICU staff and the emergency ward staffs.
Right.
These are the people where we want them to get vaccinated, not the general public in general. Very high risk category patients, you would recommend the vaccination. Otherwise, for both the prevention and the treatment, for example, a close associate of the positive case whose throat swab and who's sick, for example, the wife of a guy who's admitted in the ICU, then we would recommend the same tablet, the Fluvir, what you're talking about, the same tablet to the kith and kin also as a prophylaxis. So the prevention and treatment remains the same tablet in both the cases for prevention and treatment.
That's Tamiflu.
And the vaccine, yes. Okay. Tamiflu. Okay. And the vaccination is recommended, as I told, it's only for the high risk category, mostly for the doctors, nursing staff, and the emergency ward or ICU staff, because it gives you immunity only after 2 to 3 weeks. So immediate relief is not seen when you prick, for the immediate relief. But so, as a precautionary measure, a lot of patients' relatives are asking us, and we in Nightingales in Bangalore, we've been, I think at least about 80 immunizations have been done in last week.
Okay. So is it possible for me, doctor, is it possible for me to take a vaccination, to take a Tamiflu in order to, ensure that I don't ever contract swine flu? I mean.
No, I don't think that's a good idea. This is what we wanted, what other doctor from Delhi, the Karnagal, was talking about. Do not panic and do not unnecessarily take Tamiflu or the vaccinations.
Right.
Consult your doctor, see if you fall in the high risk category, and then do the needful. Do not panic. Do not take Tamiflu just like that because one of your friend who's staying away 10 kilometers away has got it and you shook his hand, yesterday. So don't do that kind of mistakes.
Okay, because I'm asking you these questions because these are very, questions that come to somebody's mind because the fear psychosis that is going around, I mean, a lot of my friends told me that no, we should, people who love eating pork and all that, no, but swine flu. I said, no, but I don't think swine flu spreads through pork. And then I kind of researched it.
It's a misnomer per se, but definitely people should be aware that somebody has got a cold and cough. Stay away from that.
Away.
And please increase your personal hygiene habits.
Right.
The simplest, commonest one is your hand sanitizer.
Right.
That will be the best, cheapest remedy, I would say, because you cannot find soap everywhere, wherever you want.
Right.
So, as you said, the namaskar part, I think we should practice it more than shaking hands.
Yeah, do namaskar more than shaking hands. All right. I would just like to, talk of the states in the country and what has been happening. Now, you're all aware, all those of you who have been following the news, that Gujarat's Minister of State for Health, Shankar Chaudhary, has tested positive for swine flu. Now, this happened just days after the Assembly Speaker was diagnosed. Now, these you can see are the statewide figures. Definitely highest is Rajasthan. Second highest is Gujarat, then you have Telangana, Madhya Pradesh, Maharashtra. Third highest is Delhi. So Rajasthan, Gujarat and Delhi, these are the three states that have crossed the 1,000 mark when it comes to number of cases. and number of deaths, of course, highest in Rajasthan and then in Gujarat. Now, and as I just told you, the Gujarat's Minister of State for Health has actually he's tested positive for swine flu. A few days before that, the Assembly Speaker was diagnosed with H1N1. Now, the Minister is undergoing treatment from his house in isolation. And the Gujarat Speaker, Ganpat Vasava, had been admitted to a Surat hospital. So now even the politicization of swine flu has also begun. The opposition has accused the government of downplaying this entire issue. Now these, you can see, are the year-wise figures. You have figures from 2009, 12, 13, 14 and 15. 2009, of course, a huge number, more than 10,000, but then already we have in fact crossed 13,000. So we have actually taken over the 2009 figures as well. Okay, let me get Dr. Anurag Saxena's opinion on why the number of cases have increased. What is the scientific reason behind this, sir? Dr. Saxena, I can't hear you. Dr. Saxena? Okay, I believe there's an audio problem. Okay, let me get Dr. Sreenivasamurthy on that till we get Dr. Anurag Prasad's audio back, Dr. Anurag Saxena's audio back. Dr. Sreenivasamurthy, what do you think is the reason behind the increase in the number of cases? What exactly is happening here?
I think scientifically talking, the mutations which take place in the virus every year. So that's the first thing, that is a scientific explanation. But more than that, people are panicking more and they are not aware about the preventive methods and the treatment. They do not present to the right time to the hospitals and the doctors. And that's the major point I feel people are getting infected so fast. For example, person who's traveled to any of these endemic areas like Delhi, Ahmedabad, Jaipur, all that, they should be more aware. You get the sore throat, all that. For example, I told you that the patient which I have diagnosed is traveled definitely from Jaipur, acquired sore throat, all that there, and he comes back to me after about 4th or 5th day.
Okay.
The same with the other person who developed vomiting and diarrhea along with cold and cough. Very typical presentation of a swine flu. Has flown to Ahmedabad, Delhi, Chennai, and then come to Bangalore. And this is about 5 days old history. And he comes to me after 6th or 7th day. So this is the problem with awareness, that you present late and you end up in trouble. So please, people who are traveling, limit their travel as far as possible. And even if they have to travel, make sure that you follow the personal hygiene in the flights, in the trains, buses, all that. Make sure your hand sanitizer is used perfectly and on timely basis. Report to the doctors and get treated and tested if required. So testing is only if required SOS. Not that every person who's got sore throat and this would end up in test, as you were talking about rightly about the pricing part. It is very high for a common man to afford. So instead you can treat, because the treatment costs you about 480 rupees rather than
what
testing.
What is the treatment? Can you give us some details about the treatment, the Tamiflu course and all that? How many a day? How many days?
For a positive case, we give it just for 5 days, twice a day after food. That is all the treatment is about. But the right time and the right people is the point.
Okay.
It has to be given to the right people at the right time.
Okay, all right. Okay, we have with us Dr. Geeta Rani Arora. We had lost her connection in between, but she's back with us. She's the R&D head, Research and Development Head of B. Jain Pharmaceuticals. Dr. Arora, welcome to Indiapost Live. Great having you.
Yeah, thank you so much.
Yeah, we are talking about swine flu. We are talking about how it spreads. We are talking about personal hygiene, and both the other doctors on my show have stressed on the need to avoid a fear psychosis, but go to the doctor on time. Now, these are two very important things. You just don't go to the doctor and say you have swine flu. You go to the doctor, present your symptoms, and let the doctors decide if you have swine flu or not. That's very important. But can you give us your perspective? I think you are developing some kind of a homeopathic treatment for swine flu. Can you give us a little bit of detail about that? Dr. Arora, if you can just unmute your mic. Your mic is on mute. Can you unmute your mic, please?
Yeah.
Yeah, I can hear you now. Please go ahead.
Yeah. Yeah, so I'm saying that definitely the thing is, the first thing is that the government has also sent out a notification that people do not need to panic because the government is ready with the treatment, everything is there, everything is in place. So the first thing is that, and this is also just like each year the viruses are changing, they're mutating, and yes, it is difficult to treat than the earlier ones, but there is nothing to get fear. The thing is, the moment you develop any symptom, you need to see a doctor. Okay, and you don't need to decide, don't need to panic, don't need to go for test yourself. And now as far as homeopathy is concerned, yes, there are medicines available definitely in homeopathy also for flu. There have been epidemics in the past of various diseases. Homeopathy has always played a role. So for example, the Central Council of Research in Homeopathy in India has just brought out a notification where they have talked about one medicine known as arsenic album 30 to be taken 3 days as a preventive. So that's the notification which has come from a government organization that you have to take one dose each day for 3 days. But yes, the thing is, this cannot be a preventive in 100% all the cases. So as soon as you develop symptom, you must go and see a homeopath if you want to go for homeopathy as a treatment option. And there are medicines. There are medicines like arsenic album. There are medicines like gelsemium, which depending on the symptoms of the patient, they are, giving results. Because like recently there was a case which we saw, which was giving the same symptom. The H1N1 was positive and has been treated by homeopathy. I'm talking about the clinical things which we're doing. Now, recently we have Vision Pharmaceuticals has also imported one medicine, seeing this flu, because that is one homeopathic medicine which is one of the most selling medicines for flu. Okay, that the name of the medicine is Anis barbarae, and it has just been launched 2 days before. So it will be available for people to use who want to try homeopathy as a preventive. So that medicine has shown good results, and people have been using. France, this is one of the very good selling medicines as far as flu is concerned. So that we have made available in India. But yes, you have to see the doctor. You cannot, the home treatment and self as soon as it's, especially in case of immunocompromised patients, in children below young years, in pregnant women, in people above 65. Special care should be taken for those people. If there is any change, you must see a doctor immediately. Do not do home treatment. That's the first thing to do. And do not get panicked.
Right. All right. Thank you so much, Dr. Geeta. That was like a whole range of medicines that you heard there, which are available for those of you who believe and who, would prefer a homeopathic treatment over Tamiflu. Let me come back to Dr. Anurag Saxena for your final comments, sir. Basically, the fact is that the numbers are staggering. 13,000 people in India contracting H1N1, including ministers, including speakers. I mean, it is quite a scary thing, and more than 800 people dead. Your final comments on what the healthcare system overall in India can do to prevent. Okay, I believe we've lost Anurag, Dr. Anurag again. The line seems to be pretty shaky. Dr. Sreenivasamurthy, let me take final comments from you before I wrap up the show. The same question, your final comments on this menace of swine flu and the staggering numbers, sir.
Yeah, I think first thing we should impart the message to the society that do not panic. Please present to the doctors, hospitals at the earliest. Do not spread to other members in the family and friends. Stay away from infected people, any kind of flu, because you wouldn't know who's got the swine flu, who's not got.
Right.
So please stay away from anybody who's got a cold and flu kind of symptoms. Spread the knowledge among your friends and family members that you do not try to cough, sneeze, use your other common things like your mobile phones, remote controls, all that to be properly cleaned.
It's highly contagious.
Use the sanitizers. They are the ones which are highly contagious. The mobile phones are proven. A lot of studies have proven, even in the ICUs, that people carry mobile phones, and that's what will transmit the infection. So please stay away. Keep all your personal belongings very clean, and use hand sanitizers plenty. Teach your children so that even at the schools, the children do not cross-infect each other. That is another point which, as parents, all of us should make sure that our children are educated about the mode of spread and the method of prevention.
Right. Right. Okay. Dr. Anurag Saxena is back with us. Dr. Saxena, final comments. Like I said, the numbers 13,800. are staggering. The numbers are something that one should not take lightly. So the whole, how does one create the balance between not panicking yet ensuring that you know, the spread is contained?
See, if we are taking all the precautionary measures, hello, you getting me?
I'm hearing you. I can hear you. Please go ahead.
If each and every person is taking precautionary measures that they do not contract any flu by keeping a safe distance from a person who is suffering from this disease, then I think half, or I would say 60 or 70% of the problem has been sorted out. They will not be getting a flu.
Right.
So that is the most thing. Secondly, even if you get a flu, then there are certain cough etiquettes and hand washing, etc., that you have to follow so that you do not give it to anybody else. That is the second thing I would like to stress upon. And thirdly, one has to take this fear off your mind that something is going to happen to you even if you contract swine flu. 90 to 99% of patients, they become all right even after contracting a swine flu. So there is no way that one should panic about it. And even if the only thing you have to see is that you are in contact with the doctor. The doctor very time and again, as the doctor is advising, then you are in safe hands. Nothing is going to happen to you. One should
Right.
this way positively. Only then this fear cycle will go away.
Right. All right. Thank you so much, Dr. Anurag Saxena and Dr. Sreenivasamurthy. Dr. Geeta Rani Arora, homeopathy is often, you know, used as even while people are taking allopathic medicines, they also take homeopathic medicines because homeopathy, you know, goes to the stem, the root of the problem. Yeah. So, is that safe while taking Tamiflu? Can a person also take homeopathic medicines for swine flu?
Yeah, definitely they can do that. In fact, they can also take only homeopathy for the treatment of flu. That's not a problem, but it's their option. But with allopathy, they can take homeopathy. That is never going to interfere the action. But first, they have to see the experience of why at all they want to take both the line of treatment.
Right.
You know, so that is also
the diagnosis. Diagnosis is
getting
important.
the results with allopathy. Yes, diagnosis of getting better, then they can add on homeopathy. Definitely. Definitely.
All right, great. Thank you so much. I think we had a lovely and very, very informative show. We would like to bring some tweets up for you, tweets that have been doing the rounds regarding swine flu. But I would like to thank Dr. Anurag Saxena, physician, Primus Hospital, New Delhi, Dr. L. Sreenivasamurthy from Bangalore, Medical Director of Nightingale's Home Health Center, and Dr. Geeta Rani Arora, R&D Head, BJ Pharmaceuticals. All three of you, what a wonderful panel. Great information. Do not panic. Get yourself diagnosed. If you think it's common flu, after 48 hours, go immediately to the doctor. And even after 48 hours, you don't get better, go again. And then the doctor will tell you if you need to get tested, depending on the grade A, B, or C. Do not panic. Eating pork does not cause swine flu. And be sure to maintain a personal hygiene. Wash your hands regularly. Do not shake hands too much. Do not touch the remote or other utensils that an infected person is using. Keep the infected person in isolation. Hospitalization is not necessary. Okay, these are you know, some of the things that came out. Very, very important information that came out. And through Indiapost Live, as media, we are trying to bring all of you that information. So I would like all of you to react to that and let us know if you have any friends and family suffering from it. What do you think about the disease? Do you think the fear psychosis is more than the attack itself, the spread of the disease itself? Write in to us, send us your tweets at #IndiaPostLive and @IndiaPostLive. Send us your posts, your audio comments, video comments at IndiaPostLive.com. I would like to thank my guests again. It was great having them, and thanks to all of you for watching the show. Take care, be safe, don't contract swine flu. Bye-bye.